And we'll open our meeting with the Pledge of Allegiance, if you'd join me. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thanks for being here today. We'll get started right with our agenda. This meeting of the Clermont County Board of Commissioners is hereby called to order. Item B is approval of the regular session minutes of August the 20th, 2019. Board members, I know you've had those minutes since Friday, had opportunity to review them and to request any changes that you needed. Do I have a motion to approve the minutes of the regular session for 8/20/2019?
So moved.
I'll second that motion.
It's been moved and it's received a second. Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item C, we have a proclamation this morning for National Preparedness Month here in Clermont County. And Doug, I understand you're here to accept this proclamation?
I am.
We will move towards the podium here with you. Thanks for being here this morning.
You're welcome. My pleasure.
You bet. Proclamation for National Preparedness Month in Clermont County, September 2019. Whereas no community is truly prepared for a disaster until every individual, family, and household takes personal responsibility for preparedness. And whereas National Preparedness Month is a nationwide effort sponsored by the Federal Emergency Management Agency, Ready campaign to educate and empower Americans to prepare for and respond to all types of emergencies in their homes, their schools, businesses, and whereas the Clermont County Emergency Management Agency is committed to providing public education for our citizens, and whereas the Clermont County Board of Commissioners strives to alleviate suffering and protect the lives and properties of its citizens through mitigation, planning, response, and recovery for all hazards. Now therefore let it be resolved that we, the Board of Clermont County Commissioners, does hereby proclaim the month of September 2019 as National Preparedness Month in Clermont County, in honor and recognition of our citizens and the vital contributions that they make to the safety and well-being of our community here in Clermont County. And it's signed by the Clermont County Board of Commissioners, David L. Painter, President, Edwin H. Humphrey, Vice President, and Claire B. Corcoran, member of the Clermont County Board of Commissioners. Doug, on behalf of myself and the Board of Clermont County Commissioners, please accept this proclamation for Preparedness Month.
Thank you.
Thank you. And the podium's yours if you have a few things to say.
I do have a few remarks. Mr. Painter, as you did allude to, a few years ago, FEMA did launch the Ready campaign, which is a nationwide effort to prepare for, respond to, and recover from emergencies that could affect families, homes, and communities. We encourage all residents, visitors, and community partners to take some simple steps to increase their level of preparedness. 4 points that are stressed in the Ready campaign are: number one, get informed about the different hazards that could occur in your community and the multiple ways you can receive warnings and alerts. Learn the appropriate response to the risks that you and your family may face. 2, create a family emergency plan. You and your loved ones may not be together when a disaster strikes, so it's important to plan in advance. Develop a plan on how you will communicate with one another, how and where you will reconnect, and what you will do in each type of emergency. 3, build an emergency kit. Following a disaster, it may take time for power to be restored and emergency workers to reach your community. It's important to have an emergency supply kit with food, water, and other necessary supplies, including critical medications, to last a minimum of 3 days. And 4, spread the preparedness message with relatives, friends, and neighbors. For more disaster information materials, feel free to go to ema.clermontcountyohio.gov/preparedness/. Thank you.
Thank you. And if you would honor us with a picture.
I would be delighted.
Great.
because I blink every time. I do, I blink every time. Thank you very much.
You're welcome.
We're getting you those Hollywood glasses.
Huh?
We're getting you those Hollywood glasses.
I know, I need them.
And if you didn't know, Clermont County has a hazardous mitigation plan where they look over all the scenarios that could happen in Clermont County so that we as a county are prepared to help the citizens who are obviously impacted from those type of disasters around our community. We'll move on. I understand that we have a presentation this morning from Produce Perks Midwest Incorporated. Travis Foreman, the executive director, is here for a nutrition incentive program for SNAP recipients. And before we get started, I had asked some questions about that when I saw it come through, and we wanted to get some more information about that. And the podium's yours if you would like to address the folks who are here. Thanks for coming.
My pleasure. Thanks for having us. Brought a few folders.
Thank you.
Just kind of highlighting overviews of the work.
Thank you.
Yes. Thank you. Hello, everyone. Commissioners, President Painter. So my name is Tevis Foreman, and I represent Produce Perks Midwest. We are a 501c3 organization headquartered in Hamilton County, but serving the state of Ohio. Our flagship program, Produce Perks, is Ohio's nutrition incentive program. And in short, the work seeks to incentivize the purchase and consumption of healthy foods with a primary focus on low-income consumers, as well as a primary focus on farmers markets and other direct-to-consumer locations that are directly benefiting our small to medium-sized specialty crop growers and localized economies and communities. So in short, the program provides a dollar-for-dollar match on the SNAP dollar. So when a SNAP beneficiary chooses to shop at participating locations, we provide a matching dollar on that SNAP dollar. Stretching the SNAP dollar further, a lot of data and evidence shows that SNAP households that receive these SNAP benefits typically do run out of food at the end of the month. We do know that the health of the populations we're serving is significantly higher in chronic disease and other nutrition-related illnesses. So the incentivizing of and purchasing of healthy foods is the premise of the program, as well as creating economic impact. So again, the SNAP consumer receives a dollar-for-dollar match when they shop at participating locations. Our matching dollar can only be used on produce. Stretches that SNAP dollar for other household items. We have 100+ locations across the state, about 30+ counties that the program's operational within. Again, the majority of our participating locations are direct-to-consumer sites, so farmers markets, farm stands, mobile markets, community-supported agriculture type programs, again, where we're connecting the consumer directly to the farmer. Though we are mindfully scaling into the grocery retail setting, we're in approximately 20 grocery stores across the state. And again, with the grocery stores, we seek to identify grocery stores that have shared values around community, around agriculture, and local economic impact. So you won't find us really in big box stores. We seek out independent, cooperative, or family-owned grocery stores that are in the communities that we're seeking to serve, and again, that have aligned values. And the implementation within the grocery store setting is to provide greater convenience for our consumer, right? Programming has been operational since about 2017. We receive support, so our work, the work of nutrition incentive programming, is an evidence-based model. It's deployed nationally. We're supported through the USDA, through the Farm Bill. Produce Perks is simply Ohio's version of nutrition incentive programming, though I will say that there are a few states across the country that are doing this work to the scope and scale in which we are here in Ohio. In 2018, we generated just over $800,000 in healthy food purchases by those we're serving. And those are dollars going directly back into very local economies and directly benefiting our farmers and small independent businesses, our grocery retailers that we serve. And we saw 166% growth from 2017 into 2018. A lot of that was due to our federal award and our increase in budget. This past year, we had led a legislative campaign with the state of Ohio and received appropriations to the TANF block grant. So we'll be seeking to expand and deepen the work further across the state through both federal support as well as state dollar support. We work very closely with the Ohio Department of Jobs and Family Services at both a state and county level. So when SNAP beneficiaries sign up for SNAP benefits, they receive information about the program. We have numerous touch points for our consumers that we hit on. And so we work very closely with state agencies. The Department of Jobs and Family Services, the Ohio Department of Health has been a significant investor and partner in this work. Department of Aging as well as another state agency that formally sits on an advisory committee. So we convene a statewide coalition, again comprised of state agencies, those that I've named, along with other regional and local stakeholders as well. And I'll stop there. In short, that's the work of the Produce Perks program. And so again, supported at the federal and state level, backing the dollars that are going to support the consumers and back into our farmers markets and grocery retail settings. And conversations that we're now beginning to have at the county levels across the state is how to further build the capacity and infrastructure within the county, whether that's working directly with grocery retailers and or farmers markets and other direct-to-consumer sites, coalitions of farmers and so forth that sometimes represent regional parts of the state. So the county by county level work that we're seeking to now do is to again build capacity and infrastructure of said counties to better serve both their farmers as well as their SNAP constituents. I can say with certainty, and our data certainly backs this up, that the counties that have greater infrastructure and capacity to serve both their farmers as well as their retailers, we see the highest utilization rates and so forth. So again, as conversations that we're beginning to have at the county level, and President Painter had asked me to come out to share our work. And in short, that's what I'm here for.
And just a question,
Yeah.
what are some of the restraints to do? And I'll just tell you, I reviewed the information and the data, and one of the things I looked at is that we're not really well covered by this particular program as far as infrastructure.
Clermont County, yes.
What are some of the restraints to getting this infrastructure in place, and how do you typically communicate with local farmers markets, that kind of stuff?
Well, we tend, our first step is typically an assessment of the partners that we may have in the region. And again, turn to the Department of Jobs and Family Services at a county level, but we also work very closely with Ohio State University Extension, in particular their SNAP Ed, but also their extension offices across the state as well. So OSU, both SNAP Ed as well as extension offices are key partners that we first turn to and work with when we look to do capacity building and infrastructure development within counties, as they have the relationships that we may not have, right? Okay. And so we turn to local partners in that sense to identify the relationships that exist, the momentum and synergies that are currently happening, because oftentimes there are initiatives around food access and food system development at local levels. So seeking to understand what current work is going on, what networks exist, and then either building off of that or just beginning to identify and convene partners to take the appropriate next steps.
Okay.
Yeah.
And Tevis also, for general information, a lot of people don't know what SNAP is, but the Supplemental Assistance Program
Yeah,
and the
Supplemental
explanation.
Nutrition Assistance Program.
Right.
It's formerly known as food stamps, an antiquated term these days, but SNAP beneficiaries receive food assistance at the federal level. And also a rather contentious issue across our state and across the country as well. And part of our work and the intent around it is to not only improve health outcomes as well as create greater economic impact, but we believe we're working to refocus these SNAP dollars to create the highest and best use of them, where they improve health of those that are struggling with significant chronic disease within our state and across the country. But so it's repurposing those dollars that are supporting food for low-income households to create greater impacts on health within the household, as well as to create economic impact within the communities in the regions in which they are, both at that small business level, but also within our small and medium-sized, especially crop growers, which those family farmers that we have across our state and across the country for that matter, they too are struggling economically, right? And so the work is, again, in our opinion, making the highest and best use of these SNAP dollars, right? Creating the impacts in health, which have long-term returns, and then creating the impacts directly at that local level and directly for the farmer, increasing those revenues.
So, and how does that work? If I'm a SNAP recipient and I go to a participating location, I use my SNAP card, and how does that happen?
Yeah, it's a good question. So I'll walk you through the consumer experience, if you will. And this is universal at all Ohio farmers markets, is that each individual vendor or farmer that comprises that market doesn't have the technology to accept that SNAP card as a payment, or credit cards typically for that matter, right? So every farmer's market across Ohio that serves SNAP consumers is registered with F&S, Food and Nutrition Services. They have their own unique SNAP equipment that they're able to swipe that SNAP card. So the SNAP consumer that is accustomed to shopping at farmers markets understands the shopping experience and process. But they'll go to that market manager booth, they'll swipe their card, and we provide up to a $20 match. I can get into some of those details too, but a $20 match on that SNAP dollar. So that consumer will go to that market manager booth before they do their shopping, swipe their SNAP card for say $20. They then will be issued $20 in short wooden tokens, like an alternate currency, a token that they then shop with at all the participating vendors and farmers of the farmers market. And then each market's unique as far as the redemption from their vendors and farmers, but at the end of the day, at the end of the week, those farmers turn in those tokens, right, and the market reimburses them accordingly. Some markets have the capacity to reimburse them at the end of the day, others wait to do it at the end of the month and so forth. But so again, that SNAP consumer will go to that market manager booth, swipe their card for $20. They'll receive their $20 in SNAP tokens and then $20 in Produce Perks tokens. So they have $40 to go shop with. And they shop with the tokens accordingly. Our tokens, and part of our work to lead a singular program across the state, is that our tokens are universal at any and all farmers markets. So whether you go to the Loveland Farmers Market on Tuesday and you receive your $20 match but only need $5 worth of produce, you can go to the next farmers market on Thursday or the next one on Friday in Hamilton County or any other, Warren County or any other, markets that one may access. So our tokens are universal. They spend at all farmers markets across the state. They have no expiration. And we work very closely with all of our farmers markets around data collection and reporting and invoicing at the end of the month. So those markets will collect the appropriate data. We're tracking each individual SNAP user that uses the program. We're tracking the dollars that are going out and the dollars that are coming in, as well as the SNAP dollars that are being spent. And the work continues to show increases in SNAP dollars going into these direct-to-consumer sites. Year after year, we see growth in SNAP consumers, both using the program, returning customers, as well as new users, and then increases in SNAP dollars as well as our Produce Perks dollars, annual growth year after year within our direct-to-consumer sites. Like I said, we did over $800,000 in 2018, which were SNAP and Produce Perks dollars combined going into our farmers markets and other direct-to-consumer sites across the state. So that's, in short, the experience the consumer has at the farmers market setting. It's this token-based system. And within the grocery retail, it's slightly different. Depending on the point of sale system and the technology within the grocery retail store, that customer either receives an automatic discount. So if they're buying $10 worth of groceries, $5 worth of that purchase is fruit and vegetables, it only charges them $5 in short. That automatic dollar for dollar difference is applied at the swipe of the card when they're checking out. It's a pretty clean and simple process there in the grocery retail setting. For the grocery retailers that don't have a more sophisticated point of sale system, we've modified it to where coupons are issued. So then they have a $5 or a $10 coupon based on the purchase they made, gets issued so they can redeem that for produce at the next visit.
And just for the common talking here, not to say one place or another in Clermont County. If this were set up at a grocery retail, and just to use a name there, not to pick one because everyone's familiar with it, we'll just pick Jungle Gyms.
Yeah.
Jungle Gyms obviously is a solely owned retail institution. Yeah, and that could be set up right there where that actually could be used in a setting like that. Is that a possibility?
It is certainly possible. Yeah.
Okay. And what's the restriction, or what are your hurdles getting things like that in place in Clermont County, so that people who are using SNAP assistance here in Clermont County don't have to travel anywhere but Clermont County?
But to where they, that's
to where they regularly
the
shop.
focus is understanding where are consumers shopping and where can we provide greatest ease and convenience for them to incorporate these healthy lifestyle behaviors, right?
Okay.
And well, again, it's having the partnerships at that county level to understand what retailers or markets within the communities are serving those that we're seeking to serve, right? And then we do the legwork, if you will, with the technical assistance and the capacity building within said grocery retailers to offer and implement the program.
And I would just offer up a name there. You did name the extension office and some other places, but one that you may have left out would be the Clermont County Chamber.
Okay,
You know,
yeah.
they are obviously
as well across
yeah.
certain counties.
Matt Van Sant and his team down there, have the pulse on almost all the businesses that are in Clermont County. So
Well,
that'd be a great asset to you.
If I may follow up after to exchange contacts, or at least to reach out to
Absolutely.
to the council there, yeah.
Mm-hmm.
So where does the match money come from? So we know they use the SNAP card. Where does the match money come
Produce
from
dollars?
for various locations?
Good question. From the USDA. So through the USDA within the Farm Bill, both in the past Farm Bill and the most recent, funding for this work across the country, it comes from the Farm Bill. And so it's the Gus Schumacher Nutrition Incentive Program is the particular program within the Farm Bill and the particular line item. The Gus Schumacher Nutrition Incentive Program is embedded within the Farm Bill, and we had submitted a grant application, in short, to that particular program at the end of 2017. It was awarded in 2018. It was a 3-year, $2.27 million award to scale and support programming across the state. And again, we led a legislative effort this past budget cycle within the state legislature, and worked to appropriate state dollars to further support and expand programming. As we start to implement within grocery retail settings, the volume of SNAP sales and purchases significantly increases. And so to be able to provide that convenience to the customers we're serving, as well as expand into settings that are such as grocery stores that are conveniently serving our communities and customers, increase in budget to support those was needed. Yeah. And we also have longer-term intentions within the grocery retail setting around hoping to bridge the gap that exists between our local and regional producers in our grocery stores as well. We'd like to eventually have the program operating at a level where there's a certain standard or benchmark that our grocery retailers have to meet as far as procurement of local or regional foods from producers. And there's a long way to go in that front, in that relationship building and the supply chains that exist. But nonetheless, part of our work and conversations that we're having, both with our farmers as well as our grocery retailers, is working towards those ends. And as we build consumer demand, the grocery stores can kind of a waiting list, if you will, of grocery stores that are wanting to come on board. And so as we build consumer demand for the program, the demand for the grocery retailers continues to increase, and then hopefully provide some leverage conversation points to talk to in regards to further sourcing and procuring and from local and regional producers, and helping to bridge that gap that currently exists. Part of our bigger vision around food system development with our work.
Anything else?
Yeah.
And you came with someone today. Would you like to introduce him?
Yes, Andrew, would you like to say? I'll let you introduce yourself.
My name is Andrew Jacqueline. I'm the intern here at Produce Perks. I've worked a lot with policy and communication efforts, more specifically with the recent policy campaign at the State House, and I'm really just here for moral support today.
Andrew is a recent graduate from Ohio University with a major in both political science as well as communications. So he came on as a policy intern for us to start our legislative campaign earlier this year, and still with us today.
Good.
He'll be doing the speaking here perhaps in a few months.
Yes.
Not yet, though.
Look forward to it.
And I'll also add quickly that, so we run that Produce Perks program, which is our flagship program that serves the state. Aligned to that, we've been mindfully scaling a produce prescription program. So we're working directly with healthcare providers within the clinical setting to identify specific patient cohorts that are experiencing chronic disease. So whether it's diabetes, hypertension, cardiovascular disease, so nutrition-related illnesses, we're working with select healthcare partners to identify those specific patient cohorts, enroll them in our produce prescription program, and then, in short, those patients and their families see the provider on a monthly basis. Prescriptions are, physical prescriptions are written that have a monetary value that are redeemable at all of our participating farmers markets and grocery retailers across the state. Now, those prescriptions are written, the quantity of the prescription is based off of the household size. So though we identify a single patient dealing with, let's say, diabetes, the data certainly shows that the household, the kids most likely are pre-diabetic, or there are other individuals experiencing nutrition-related illnesses within that household. So that we identify the single patient, we write prescriptions based on the entire household's food needs on a monthly basis. And again, they redeem those prescriptions at participating farmers markets and grocery retailers within their neighborhoods. This work, too, is supported at the federal level through the USDA within the Gus Schumacher Nutrition Incentive Program. The Ohio Department of Health has been a strong partner, and both our programming, Produce Perks as well as the prescription programming, is written within the State Health Improvement Plan. And so we're working closely with ODH around the expansion and scaling of prescription programs in coordination with many of our healthcare providers across the state, as well as the Association of Federally Qualified Health Centers and so forth. And again, it's very much aligned with Produce Perks from a food security and nutrition and health and wellness premise, but also doubling the impact at that local level with our farmers markets and so forth, right? So this is another revenue stream of dollars that are coming in, purchasing the product that our farmers and grocery retailers are offering. So there's a brief overview in the folders there of our prescription program, but it's something that we are in the nascent stages of building out, and we envision it very much being integrated with what we're doing with Produce Perks, the infrastructure that we continue to build across the state, and again, both federal and state level sources to actually support the dollars that are backing the healthy food for those that we're serving.
Any other questions, board? Tevis, thanks so much for coming in today.
My pleasure. I
You did
appreciate it, you guys.
you did an excellent job explaining it and answering a lot of questions that were here. And it's kind of a segue because the next presentation we have is Horan, and it's all about health.
Okay, well,
So there we go. Thank you.
yeah,
Thank you so much.
Thank you very much.
And we will move on with a presentation from Horan Associates. Steve Ashe, the Vice President of Account Management, is here for proposed healthcare benefits program for calendar year 2020.
Yes, thank you.
You
Appreciate
bet.
you having me.
Thank you.
All right, so we will jump right in. Again, we have some recommendations for the healthcare plan for 2020. So we'll run through those as well as some contributions. So first, we'll go with the medical renewal and plan design recommendations. We'll then get into the 2020 contribution recommendations, so what the employees pay for the insurance as well as what the county pays for the insurance. We'll also look at some benchmarking so we can see where that aligns with other like entities. We'll then get into the dental bid renewal and recommendations, and then we'll just wrap up with the other benefit renewals just so we have it all in one nice spot. So medical renewal recommendations, we are recommending renewing with UHC. That rate is increasing $1.05 per employee per month per the agreement, the 3-year guarantee, which we talked about last time. We do have some plan design changes. We're going to recommend moving to UHC's Primary Advantage PPO plan, and we're going with the $5,500 single and $11,000 family out-of-pocket maximum on that, so not the one that was higher. We looked at 2 options, so the one that is lower. We have to remove the copay card accumulator due to recent legislation. Essentially what that is when an employee goes and they have one of those manufacturer drug coupons. What happened is if they paid $50 for that drug because of that coupon, it used to show that that member met their entire deductible. So they would get credit for the entire deductible. Well, the PBMs, the pharmacy benefit managers, kind of got ahead of that and said, listen, if you're only paying $50, we're only going to apply $50 to your deductible. That's what you've met because that's what you've paid. Well, recent legislation has come out, so we now have to remove that copay card accumulator. So if somebody uses one of those coupons, they will get credit for that entire drug cost, not just the portion they paid. And then we want to continue with plan design changes implemented in previous years, such as the bundling solution, specialist hearing, etc. So we touched on those last time. From a contribution piece, we want to continue with the tobacco cessation and PCP discounts, as well as with the same HSA contributions for the high deductible health plan. And we have a couple scenarios on the employee contributions for the actual plan design. So this chart, this should look familiar. This is the chart that just outlines all the various costs in your self-funded medical program. This is showing an 8.2% increase. This is illustrating the 50% increase on stop loss from the Symetra renewal. However, we mentioned that we believed the market would respond fairly favorably and we'd be able to get some more competitive renewals from the stop loss. We did get a couple that have come in around 25-27% currently. That's prior to negotiation. So we do feel comfortable going with the 25% illustrated stop loss increase. So it brings the overall increase to that 6.9%. So that is where we basically started when we started looking at plan design changes. So HR, the Healthcare Advisory Committee in Horan recommend the following primary advantage plan. On the left-hand side, you can see the current PPO, and then on the right-hand side, you can see that primary advantage plan. So you can see it lines up pretty similar to the current PPO. A couple of nice enhancements are the office visits, so your primary care physician visits are $0. You also have virtual visits at $0. That's kind of that teledoc program. Lower urgent care costs, and then emergency room is somewhat similar. It's a little bit different breakout, but if you compare them, it's pretty similar. The biggest change is going to be the out-of-pockets going up. However, this nets us about a 4.7% savings, or $545,000. So we believe with this plan design, somewhat modest, it gets us to a more reasonable renewal. The other thing that I want to point out on this plan that's really nice is those office visits are at $0 copay. So this whole plan is designed to try to steer you to the appropriate place of care. We had given you one of our data bites that Horan does, our financial analyst team. And what this shows is if you have a primary care physician visit, your costs on average are 11% lower than those that do not. So we really like that plan. It aligns with the data. And a few years ago, we also put in that primary care physician initiative, which is also steering people to the primary care physicians. So we thought this was a nice piece to share. So we then want to go over some benchmarks. So this is PPO benchmarks. What we really see is outside of the deductible and out-of-pocket, they really do align really nicely, along with copays, RX copays, etc. Even better on, again, that primary care now that that's lower, urgent care now that that is lower as well. Then on the high deductible health plan, you can see that that aligns right in line with benchmarks with where we have the current high deductible health plan. So I know this slide's very busy. We just wanted to get everything on one page for this one, but we will zoom in on really the net impact to the employee. So this really just shows you your current enrollment, participants that are tobacco free, participants in the PCP, the overall rate, employees percent and dollar, and the change. So again, there's a lot going on here. This is the PPO. The top is tobacco free credit. The bottom is with the tobacco charge included. The next slide, this is the high deductible health plan. Same piece. We understand it's extremely busy. We just needed to get everything on one slide. So this is the contribution scenario number 1. So this really shows what the impact would be to the employees. This is showing the same employee percent contribution as it is today. So basically what that means is the employees in the county will split it based on what they currently pay. So you can see on the PPO, you can see the rate change here. This is listed per pay. So if you essentially kept the same percentages as today, on the PPO plan, the single would go up $1.05 per pay. Family would go up $4.99 per pay. On the high deductible health plan, you can see single would go up 67 cents per pay, and if you look all the way down at family, it'd go up $3.51 per pay. And then that bottom chart really just shows the net effect when you look at what the county would pay and what the employees would pay. You have your current, the renewal, the dollar change. So in this instance, the employees would pick up an additional $56,720, and the county would take on $290,000. So the other contribution that we wanted to present you with is keeping the employees' dollar the same. So obviously the impact of the employees, if you kept their dollar the same, would be a $0 increase per pay. However, the county would end up having to take on more because the employees are not taking on anything additional. And you can see on the bottom of this chart, the county's costs would go up about $347,000 in this instance. So working with the HR and the Healthcare Advisory Committee, we wanted to show 2 different scenarios based on budgets and what the county may be able to absorb. So that's where we look for some guidance from you. So those are the 2 employee contribution scenarios. We then want to get into the premium benchmarks. Since we talked about the contributions, how do these stack up to similar other counties within the benchmarking? You can see the actual cost, total plan cost on the left-hand side aligns up pretty nicely. And then on the right-hand side, you can actually see the Clermont County employees actually pay quite a bit less. So that is nice. The next chart similar. This is just the high deductible health plan. So on the left-hand side, you have the total cost. And then on the right-hand side, you have the employee contribution. So again, the employees are paying less in premiums, which is very nice. Before I go into the dental renewal, are there any questions? I know that was a lot of information.
I got a couple questions.
Yes.
So the stop loss at 25%, that reduces our increase to 6.9%. What does what happens to our increase if we initiate the new PPO plan? How much money did that save us, and what percentage does that
Took
go
it
down?
down 4.7%.
So we would be at
$545,000.
so we'd be at like a 2.7% increase.
I believe.
Okay.
Yes.
Okay.
Yep.
And then what is your book of business seeing as far as overall increases in healthcare costs?
Trend is around 7 to 8%.
7 to 8%.
Yep.
Okay. So we're right in line with that.
Yes. Yes.
Okay.
You're right in line from that starting point. Yes, slightly below, at that 6.9. But then with some of those plan design changes, obviously we well below that.
Okay.
All right, so we're gonna now transition into the dental renewal. Last time we were out here, we mentioned pretty much good news across the board. We said if we remain self-funded, it was projected to go down 4.4%. We also went out to the market. We got fully insured quotes. We looked at enhancing the dental plan. Our recommendation is, due to the disruption as well as the competitive data and our ability to negotiate with DCP, is renewing with Dental Care Plus. So again, no disruption to the employees. What we were able to do is get an enhanced dental plan with reduced premiums. So moving forward with a dual option, we do want to go forward with a traditional plan, which you have today, and then also adding an enhanced orthodontia option with an increased maximum. So almost like a Cadillac plan, if you will, on the dental. We would eliminate that preventive plan. There's 51 employees in there, so they would need to move to that traditional plan, and that'd be about a $5 increase in premium per pay. So not a huge impact to many employees. Remaining with Dental Care Plus allows us to avoid that 29% provider disruption that would have occurred had we moved to Superior Dental. This next slide just shows you the financials on it. So we did a good job working with DCP, and DCP partnered with Clermont County. They did match rates for Superior, and it's going down 6.9% overall. So about a $35,000 savings, guaranteed for 2 years. So about a $70,000 savings over the course of the contract. And they did give a third-year rate cap of 8%. If the plan runs high enough, that would be the cap. So, and we could always bid it again as well. So you can see the rates there at the bottom. On the left, you have the current. Then you can see the renewal on the traditional plan. So it goes from 2628 employee only to 2450. So you can see the decrease. Superior's rates are listed next. You can see they DCP matched. And then on the right-hand side, so this is that orthodontia plan with an increased annual maximum. So you can see how that matches up to the current traditional type plan as well. So then we'll just get into some of the details that I'd mentioned. So DCP, 100% of the providers are obviously in network. Superior, there would have been that 29% disruption. So because they came down, matched rates, enhanced the plan, we felt it was a good move to remove DCP. Kind of wrap up. Here's the additional ancillary lines of coverage. So this is the same slide as last time. The only thing I do want to point out is you can see Charge Snyder's in bold. Last time we showed that renewing as of 2020. However, there was a multi-year contract agreed to last year, so that doesn't renew until 2022. So next steps are decisions on the medical contributions. So we showed you two different scenarios there. We will need a decision on the stop-loss carrier. We will need to get them additional data to finalize those stop-loss quotes. But again, where we're currently at, we do have some in the 25 to 27% increase range. Now, I do have to just mention that could change if all of a sudden we had several catastrophic claims present themselves in the plan. However, we feel pretty good about that right now. We'll need a decision just on final dental carrier. And then we have a benefits fair on October 8th. We will have a mammogram van and flu shots available. Open enrollment is tentatively set for October 22nd through November 4th. And as last time I mentioned, we're planning on creating a nice video to really outline all of the benefits so all employees can watch that. Are there any other questions?
The presentation that you made today, the Healthcare Advisory Committee has looked at those.
Yes.
that presentation, and those are the recommendations that they're making? Okay. And when do you need those 3 decisions by?
Open enrollment, October 27th. I mean, if we had those in the next few weeks, to be honest, so no huge rush. We would need to let UHC know so they can build that new plan. So, I mean, the sooner the better.
Okay.
But the latest, I'd say 2 to 3 weeks.
And I was planning to submit a motion on the 18th of September.
There you
There you go.
go. Perfect timing.
Steve, as always, you did a great job. Any questions, board? Further clarifications? Thank you.
Thank you. Appreciate your time.
Thank you.
Any other presentations, Tom?
No, sir.
Then we'll move to item number E, public participation. If anyone's here today from the public that'd like to participate in this meeting, you are more than welcome to do so by just raising your hand and being recognized by the board president. Anyone like to participate from the public? Seeing none, I'll close public participation, and we will move to item F, consent agenda. Board of consent agenda has been prepared. I know you've had ample time to review it and to ask questions. Are there any items that need to be removed from the consent agenda for further discussion or clarification prior to me seeking a motion? None? Then I would request a motion to approve the consent agenda as presented.
I'll make that motion.
Second.
It's been moved and received a second. Any further conversation or clarification? Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Item number G, we will move to the non-consent agenda, which starts on page 7. Item number 11 is the recommendation the Board of Commissioners adopt resolution number 132-19, resolving to approve payment and vendors in the total amount of $1,237,111.90 as set forth in the BCC approval invoice reports for the checks dated August 28, 2019, and the BCC directed prepaid invoice report presented by the county auditor on August 26, 2019, and further resolving the county auditor to issue warrants for the same pursuant to section 319.16 of the Ohio Revised Code. Do I have a motion?
So moved.
I'll second that motion.
Been moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item number 12, water resources. Morning, Lyle.
Morning. Item number 12 is a recommendation to approve the request to advertise for bids for the furnishing and delivery of chemicals for the county waterworks system. This is pursuant to the specifications, and to authorize the clerk of the board to place a legal notice in a newspaper of general circulation on September 5th, 2019. Schedule a non-mandatory pre-bid meeting on Thursday, September 12th, 2019 at 10 a.m. with bids to be received until 2:00 p.m. local time on Thursday, October 3rd, 2019, here in the office of the Board of County Commissioners, where they will be opened and publicly opened and read aloud shortly thereafter, and this legal notice will also be posted on the county's website. So this is for purchase of chemicals for the treatment of water at our 3 water treatment plants. It includes aluminum sulfate, chlorine, fluoride, caustic soda, and potassium permanganate. We typically spend about $700,000 a year on chemicals, depending on the type of summer we're having and how much water we're treating. So that's always subject to that.
Okay. Do I have a motion for approval item number 12?
I'll make that motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Thank you. Item number 13.
Item 13 is a recommendation to adopt resolution number 133-19, resolving to authorize First Transit, Inc. for and on behalf of the Clermont County Board of County Commissioners to file an application with the Ohio Department of Transportation for the Urban Transit Program for state fiscal year 2020 in the amount of $201,623, and to authorize David L. Painter, President of the Board of County Commissioners, to execute the standard state assurances relative thereto, pursuant to and in compliance with the terms and conditions set forth therein.
Board, you've heard the reading of item number 13. Do I have a motion?
I move.
I'll second that motion.
Been moved and second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item number 14. It's the recommendation of the Board of Clermont County Commissioners of Clermont County, Ohio, to adopt resolution number 134-19, resolving to applaud and sincerely thank Governor Mike DeWine, House Speaker Larry Householder, Senate President Larry Obhoff, and the members of the Ohio General Assembly for their strong support of the state countywide partnership in the state operating budget, and to express our deep appreciation of the historical investments made into indigent defense reimbursement that will help relieve counties of the growing cost pressures of this state mandated service. And just to talk about that a second, Commissioner Humphrey, if you would just expand on indigent defense and how that worked before the governor included additional reimbursement.
The indigent defense was in the Constitution to be a state program, but somehow they moved it off to the county. And we received 49, got even lower than that, percent reimbursement from the state. And this takes it over the 2 years to back to 100% at the rate at which we were going before. Unfortunately, though, the defenders have asked for additional money, some share of that, so we need to address that in the future.
Okay. And to express their deep gratitude for the significant state investment into children's services, which will help counties provide critical care to our most precious and vulnerable residents, our children. To express our appreciation of the sales tax reforms, to modernize Ohio's sales tax statutes in remote seller nexus, which will promote marketplace fairness and bolster the largest county revenue stream, and to applaud the increase in the local government fund as an anticipated investment by the state, an appreciated investment by the state into county government to fund critical public services, and that we, the Board of Clermont County Commissioners, sincerely appreciate Governor DeWine, Speaker Householder, President Obhoff, and all the members of the Ohio General Assembly for listening to county's concerns, addressing many of the issues in the state operating budget, and for making tremendous headway into the strengthening of our state and county partnership to better serve all Ohioans and our residents here in Clermont County. Board, you've heard the reading of item number 14. Do I have a motion for approval?
I'll make that motion.
Second.
It's been moved and received a second. Any further conversation or discussion?
I hope that we could present a copy of that resolution to all the persons named here plus CCAO so that they're aware.
Okay. Nothing further? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item number 15.
Item 15 is a recommendation to approve a request to extend the expiration date for the disposition of proposals received on May 30th for the payments by financial transaction devices for Clermont County, and that'll extend it from Thursday, August 29th to Friday, October 25th, to provide additional time to finalize the multiple contract documents therefore.
Board, you've heard the reading of item number 15. Do I have a motion?
So moved.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item number 16. Morning, Mary.
Mary Raines of OMB. And item 16 is a request to increase the annual appropriations for 2019 in the Sheriff's Records and Support Retirement Payout Account in the amount of $840.26 for the retirement of employees.
Board, you've heard the reading of item number 16. Do I have a motion for approval?
I'll make that motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item number H. Any additions to the agenda at this time, Tom?
Yes, sir.
Okay, then I'll move to item number I. I'm requesting an executive session pursuant to section 121.22, G1, G3, and G6 of the Ohio Revised Code to first, consider the employment, dismissal, discipline, or compensation of one or more public employees. Second, to confer with the prosecuting attorney regarding pending or imminent litigation. And lastly, to discuss details relative to the security arrangements and emergency response protocols for a public body or a public office, respectively. Board, you've heard me request for an executive session. Do I have a motion?
I move that we have executive session.
I'll second that
Been
motion.
moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Corcoran?
Yes.
Painter?
Yes, we will proceed to executive session. We will return, and we will conduct further business. Thank you. We've returned from executive session. No decisions were made, and we'll move right on with the agenda. Tom, I'll request one time. Do we have any further additions to the agenda?
We have a personnel action with Clermont Transportation Connection for the board's consideration to add to the agenda.
Board, do I have a motion to add that HR consideration to the agenda?
I'll make that motion.
Second.
Been moved and received a second. Roll call, Judy?
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Tom, could you read for us?
Yes, sir. Clermont Transportation Connection, Tim Colony, vehicle operator, non-CDL, termination, probationary removal, effective 8/28/2019.
Board, you've heard the reading of the request for termination. Do I have a motion for consideration?
I move to approve.
I'll second that motion.
It's been moved and second. Any further conversation or discussion? Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Any further additions?
Yes, sir.
I'll move to item J, county staff or elected official discussion. Any county staff or elected officials like to talk to the board today?
Oh, that's good timing, isn't it?
Absolutely. Linda Fraley, the current auditor of Clermont County.
That's good.
Podium is yours.
I just got a call. Auditor of State Keith Faber would like to meet with elected officials next Wednesday at 1 o'clock. And I told him that I would, get your schedule or agenda. I didn't see it for next week to see if that would be a doable time for you. He would be coming here, a round table. So.
And I'm not sure we can meet as a round table, but I'm out of town for the next 2 weeks, so I
Well, he
won't
asked
be
if
here
I had
next
any
week.
agenda items, and one of the agenda items that I would like to talk about is the economic indicators.
Okay.
That's a good thing. We could have staff represent us there. That would be
Okay.
fine.
That'd be great.
So,
Tom?
he's
you
talking
available?
about being down about 1 o'clock next Wednesday?
Right.
Okay.
Or you could have the president of the board go.
We could have the president and staff, yes.
Okay.
He asked if I'd bring a couple of my staff members, but I didn't know whether the 1 o'clock would work with your meeting.
We will
It
check.
does.
Yeah.
I'm sure it does.
We'll make sure we'll
I
make
haven't- I
arrangements
haven't-
for that. And if there is a problem, we'll get back with you, let you
Okay.
know
All right.
Okay.
quickly.
Where will it be? Linda, here in this?
Yeah,
in
he said
this-
just like, he mentioned where we met for the post audit, so.
Oh, third
shared-
floor
shared-
conference?
Shared
Okay.
conference, so if you
Okay.
could see if that's available.
Okay.
Thank
Right?
you.
All right, thank you.
Thanks for the invitation. Anything else? County staff are elected?
I'd like to,
Go ahead.
no, go right ahead.
Item number K is board member comments. Any comments from the board?
Just one comment today, since items number 1 through 5 dealt with suicide prevention of young children. I'd like to make the community aware that on September the 10th, there's going to be a candlelight vigil, which will be at Riverside Park, and that is in Milford, Ohio, and that'll be 7 to 8:30 p.m. And it is the World Suicide Prevention Day. And the reason I'd like to bring that up today is not only because we voted on these items to help and assist our children, but my concern is out there on social media that there is a lot of, I'll say adults, but people my age, older, who make comments out there regarding suicide and making a mockery of it or saying that it's not something of importance in our society. And I think until you walk in the shoes of those families and those relatives who have dealt with such a serious problem in our society, and especially in our youth, that we should minimize our comments, and if we expect our children to behave in an appropriate manner, that we should do the same. But I'd like to just extend it to everyone in Clermont County. If they would participate in that vigil, I'm sure it would be very appreciative to those people who are suffering for that loss. Thank you.
And it's a shame that suicide is not recognized. If I remember right, for every 3 homicides, there are 5 suicides. But we don't hear about it. We don't hear about suicides because the media doesn't bring that to our attention, but they bring murders to our attention.
One of the things on recent news has been obviously the gun issues here in Ohio, and our hearts are with those that were impacted, here in Ohio over these recent tragedies that we've had. But one of the statistics that comes out in that is that 39,000 people lost their lives to gun incidents in 2017. Of those 39,000 people, 66% of all those people was due to suicide.
Right.
So one of the things that does get overlooked is the fact of how prevalent suicide is, and that the mental health issues associated with that.
Absolutely.
You bet.
Thank you.
And on the board session next week, we will have a proclamation recognizing Suicide Prevention
Yes.
Week in Clermont County. And I believe Leanne Watson will be here to present or to accept.
Thank you.
Any other comments from board members? Hearing none, I will ask for a motion to adjourn our meeting today.
So moved.
I'll second that motion.
It's been moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. That concludes our session for August the 28th, 2019. Thanks for being here with us today, and we will see you next week. Thank you.